Men who wish to father healthier children have been advised to marry early and start raising families before the age of 40. A consultant gynecologist and obstetrician, Dr. Ayodele Ademola, has blamed ignorance and misinformation as major reasons why many Nigerian couples delay seeking fertility treatment. Good day, viewers. Welcome back to BDM Health News Update. On our program, Your Health, Your Wealth. Viewers, I often remind you to subscribe to our YouTube channel to get the latest tips on your health. Men who wish to father healthier children have been advised to marry early and start raising families before the age of 40. President of the Nigerian Association of Urological Surgeons, Professor Nuhu Dako, gave this advice during an interview on social media. He explained that as men grow older, the quality of their sperm reduces significantly. According to him, aging affects the count, motility, and shape of sperm, and can also lead to damage in sperm DNA. The more we do research, the more we get new results. Sperm quality reduces with age. The count, motility, and morphology are all adversely affected, the consultant urologist noted. There is also an increase in damage of sperm DNA. This can lead to genetic diseases in children, he added. Professor Dako pointed out that although the decline in sperm quality varies from man to man, it becomes more obvious from the age of 40. Please try to marry before that age. He blamed this on natural aging and some lifestyle habits such as smoking, alcohol, poor nutrition, and exposure to toxic substances. Biological changes that come with age and certain lifestyles like smoking and alcohol consumption contributes greatly, he explained. His comments comes on the heels of the trending post on X handle, where a user warned that older men are more likely to father children with genetic defects. Is that right? The viral tweet claimed that conditions like autism, Down syndrome, schizophrenia, and dwarfism could result from weak sperm. So please, how healthy is your sperm? Older men are more likely to give you children with genetic mutations like dwarfism, autism, Down syndrome, and schizophrenia, the user tweeted. Please, I hope you don't want to give birth to a dwarf. Their weak sperm has a higher risk of causing mutations in kids, the post added. No be small thing. Research from the Texas Fertility Center supports this claim. It confirmed that both sperm quality and quantity drop as men age, which leads to men infertility. You can see that. Similarly, Healthline, a popular health platform, stated that sperm quality reduces drastically in men above 50 years old. That is, reduces. It linked this decline to factors such as age, lifestyle habits, and other underlying health conditions. Despite this, Professor Dakum said older men can still father healthier children if they take steps to maintain their sperm health. Yes, the things you consume determines on that. He said adopting a healthier lifestyle can improve sperm function, even though age remains a strong factor. Of course, how healthy is your food? There may not be much to prevent, but if the man is already old, the sperm definitely will reduce. But living healthier improves general and thus sperm health. So the more you improve your health, the more your sperm improves. He also spoke on medical options like genetic selection or screening of sperm to detect damage. However, he warned that these procedures are expensive and not accessible to most Nigerians. But what would they do? Genetic selections in the embryo or sperm are necessary to be checked, but they are costly and not widely available, but they are necessary. It's necessary to be checked in order not to cause damage. He concluded that donor sperm may be considered as an alternative for older couples struggling to conceive. Experts continue to warn men that delaying fatherhood could expose their children to serious health risks. So please, go and marry. They also urge young men to pay attention to their reproductive health and take steps early if they wish to have healthier offspring. Some may not call it anything, but honestly speaking, it counts a lot. As conversations about male fertility continue to gain attention online, health professionals are calling for more awareness and education on the subject, just as we are educating you right away. How healthy is your sperm? Go and run a test for it. Up next, a consultant gynecologist and obstetrician, Dr. Ayodele Ademola, has blamed ignorance and misinformation as major reasons why many Nigerian couples delay seeking fertility treatment. Dr. Ademola, who is the medical director of the Strong Tower Specialist Hospital and Fertility Center, said this while addressing journalists at an event to mark his 60th birthday over the weekend in Lagos. According to him, despite growing awareness, many couples are still hesitant to embrace in vitro fertilization, that is IVF, and other forms of assisted reproductive technology, that is the ART Act. Out there in the world today, there is so much suffering, confusion, and dilemma because people can't explain why they are not able to conceive. Honestly speaking, this is just the pure truth. Millions of people out there are yet to conceive without knowing the reasons. Dr. Ademola described IVF as a proven medical process where the sperm and egg are combined in a lab to aid conception. He noted that this form of treatment has helped many couples worldwide but remains underutilized in Nigeria due to poor knowledge, fear, and cultural beliefs. Some couples are ignorant, some feel they are too poor, others are waiting for divine intervention. Yet, technology is proving answers to all these. Or don't you think so? Check it out. He listed factors such as stigma, religion, misinformation, and poverty as major barriers preventing many couples from seeking help early. Furthermore, according to him, many couples only consider IVF after several years of failed natural attempts, when their chances have already reduced. You can imagine. In the early days, people would say, let's wait for God. That is what people often say. But with increasing success stories, more couples are now embracing IVF, Dr. stated. He, however, noted that the tide is gradually changing as awareness and counseling and helping to shift public perception. The attitude is changing. The regret many now have is that they didn't do it earlier, he stated. Okay. However, as part of his birthday celebration, Dr. Ademola announced a special initiative to support Nigerians longing for the gift of children. Oh, that's very, very thoughtful. He revealed plans to provide free intrauterine insemination, that is the IUI, to 60 patients and offer a 50% discount on IVF treatment to another 60 individuals over the next 6 months. Wow! This is really, really wonderful. This initiative is aimed at making fertility treatments more accessible and affordable. It is my humble way of giving back, a seed of hope and possibility, sown in faith and gratitude, he stated. Wow. Also speaking, an IVF specialist and medical director of Mobile Specialist Hospital, Dr. Weke Thaddeus, advised couples facing infertility to seek medical help instead of hiding in shame. Exactly. The earlier, the better. Dr. Thaddeus, who spoke on the topic, exploring alternative options to infertility, identified several conditions that require IVF. According to him, IVF is needed for men with poor sperm quality, isospermia, that is no sperm at all, and couples with long-term infertility issues, couples with tubal blockages, those who have done vasectomy or tubal ligation, and women of advanced age as also need IVF. These are the things he explained. He added that women with uterine or ovarian abnormalities, including endometriosis or absence of a uterus, cannot conceive naturally and must rely on IVF. According to the World Health Organization, that is the WHO, 17.5% of the adult population worldwide, that is 1 in 6 people, experience infertility at some point. Very sad. The global health body has called on countries to prioritize infertility care to their health policy. Also, the Association for Fertility and Reproductive Health in Nigeria estimates that about 12 million Nigerians are currently battling infertility. Oh my goodness. Oh. This figure represents nearly 10% of the country's population. You can imagine that. 12 million. Health professionals say the emotional and psychological burden of infertility can be devastating. Very, very. Especially in cultures where childbearing is highly valued. You can imagine that. They are calling for increased public enlightenment, government support, and improved access to fertility care to help affected couples find solutions early. So please, are you a victim? Know what to do at the right time. With experts sounding the alarm and new initiatives being rolled out, stakeholders say it's time for Nigeria to take infertility seriously. They are urging couples to break the silence, seek medical help, and take advantage of the technologies available to help them conceive. So please, be informed. Don't suffer in silence. There is hope. Or don't you think so? Well, I think there is hope. Also, Dr. Ademola stated that there is hope. Well, viewers, finally coming on the run in a bid to improve access to life-saving dialysis treatment, a non-governmental organization, that is the NGO, Seal Foundation, has donated dialysis machines to 5 hospitals across Nigeria. Wow. One of the machines was handed over to Bagada General Hospital in Lagos, while 4 others were delivered to Lagos State University Teaching Hospital, that is LASU Ikeja, University of Port Harcourt Teaching Hospital, that is UPTH, River State, and 2 additional hospitals in Abuja. Not be small thing. At the official presentation ceremony in Lagos, the Chief Executive Officer of the foundation, Mrs. Ubeli Lawson, said the donation was targeted at helping the less privileged who are battling kidney diseases. We are here because of the poor. Those who cannot afford dialysis deserve a chance to live, she stated. Wow. Lawson noted that the foundation's goal is to support their own reserves and ensure they can receive dialysis at a reduced cost. Wow. She also disclosed that apart from the machines, the foundation also supplies spare parts and consumables to support continuous care. Wonderful. We came not only with machines, but also with the necessary materials. The aim is to ensure treatments are affordable and accessible, she added. Well, according to her, the initiative is part of the foundation's broader mission to ease the suffering of Nigerians, especially the vulnerable population. Our hope is to bring relief, to restore hope and help. We believe this donation will touch many lives, she stressed. Of course, definitely it will. Also speaking, a UK-based nephrologist, Professor Ibi Eriko Sima, who collaborated with Seal Foundation on the project, said the machines were previously used by patients at home in the United Kingdom and were being replaced. When these machines were to be replaced, I suggested this be sent to Nigeria to benefit our people, Eriko Sima revealed. The professor explained that the burden of kidney diseases is growing rapidly in Africa due to diabetes, hypertension, and infection. He maintained that the donation would not only improve access to dialysis, but also significantly reduce its cost. I believe so too. These machines will provide consistent dialysis care up to 3 times weekly for the next year. That's a major support system, he stated. Reacting to the development, a medical director of Bagada General Hospital, Dr. Olusegun Babafemi, lauded the foundation for the gesture. Of course, they need to be lauded for. He said the hospital had been battling with limited resources and capacity to meet precious dialysis needs. This donation has come at a critical time. It will help us expand our dialysis services, he explained. Dr. Babafemi also commended the federal government's effort in subsidizing dialysis treatment and urged state governments to follow up. We appreciate NGOs trying to support patients and the underprivileged, but more collaboration is needed. This support will allow more patients access dialysis at subsidized cost, he added. The donation is expected to ease the burden of kidney care for many families, especially those who previously could not afford regular dialysis sections. Chronic kidney disease is on the rise in Nigeria, with thousands of patients unable to sustain the high cost of dialysis. You can imagine the machine they brought to the hospital, how it brings an aid to those who doesn't have. Because a typical section costs between 25,000 naira and 40,000 naira, with many patients requiring 3 sections per week. You can imagine that. Health observers have applauded Seal Foundation for the intervention, describing it as a lifetime for low-income patients battling kidney failure. As dialysis access remains limited across the country, stakeholders are calling on more NGOs, corporate bodies, and government agencies to invest in kidney care. The development comes at a time when Nigeria is grappling with an increase in non-communicable diseases, making such interventions timely and impactful. With this donation, friends, many Nigerian patients now have a renewed chance at life and better health outcome. Or don't you think so? I think these people need to be applauded for. They have really tried. So viewers, this will be all for now. Don't forget to like, comment, and share. Subscribe to our YouTube channel, Diaspora Digital Media, for more health news updates. Until next time, I remain your host, Mayor Michael Inudini. Do have a wonderful day ahead. Thanks for watching. Bye for now.